It is right that sharing confidential medical information of another is illegal, with additional risk of potential stigmatization against HIV-positive persons. It is even more critical to guard patient information fiercely. Today, the Law Express team shall take a look at the topic confidentiality and HIV. Don't go away. My name is Noella Seidu, and this is Law Express.
Rahel Ufuriata is a legal practitioner who enjoys gardening as a hobby. Dr. Edward Adodankwa is a legal practitioner with a diverse interest, including reading, playing tennis, and appreciating choral music.
Noella Seidu. She's a private legal practitioner and a consistent member of our 3-lawyer panel on the show every week. She also doubles as the host of the show. She likes to play tennis and read.
Confidentiality generally refers to a duty not to disclose to third parties or unauthorized people information received from others, which are disclosed within the spirit of secrecy and not meant for others. So narrowing in then to medical confidentiality, and we know that medical information is sensitive and is about personal or private affairs of our patients. Therefore, medical confidentiality refers to patient information or information disclosed by patients to healthcare professionals, could be the pharmacists, could be the lab, the doctors, the nurses, etc., which are disclosed within the context of healthcare, and they are therefore not meant to be disclosed to other people, other personnel who are not concerned with the care of the patient, and the professionals are supposed to keep it private, they are supposed to keep it confidential. It used to be an ethical duty, but now under the Patient Charter of Ghana, it has now been incorporated into the Public Health Act 2012, Sections 167. And therefore, it is not just an ethical duty on health workers, but also a legal obligation to keep confidence.
You know, today's conversation is not about medical confidentiality in a broader sense.
Yes.
Let's narrow it down to the situation of HIV. And we know that, look, when it comes to HIV, like other conditions,
yes,
there is a pre-diagnosis engagement, then you tested, diagnosed, and then there's probably management.
yes.
So let's look at it across all these steps in an HIV victim or patient's life situation.
Thank you very much. So you see, with HIV, there's pre-testing, there's counseling before the testing, and then there's the actual testing, and then the disclosure of the information on the status, the results of the test. Now, let me skip the counseling because it would be exhausted by the counselor in the health facility at that point. Now, given that the patient or the person in question is an adult, the disclosure can be made to that person there and then.
Is it the disclosure of the diagnosis?
Of the status after the
okay.
test. It can be made to the person momentarily. If it is a child, the procedure is different. If it is a child and is accompanied by an adult whom a medical officer or whoever is conducting the test doesn't have any reason to doubt the proximity or the closeness or the relationship, you can't disclose to that person as well. So long as it's a child. Our laws define the child as a person under 18. So any person under 18 who has gone to a health facility and there's need to conduct an HIV test on that person, the disclosure must be made to whomever accompanied there. I'm sure you are asking, what if the person walked in alone because maybe they are well-built, styled looking, 17, 16. Now our 13-year-old girls are looking like mothers already.
Yeah.
So what do you do under that? I'll leave that for Doc to answer.
Yeah, Doc, what do you do?
We have something called, people generally call it emancipated kids. People or kids who are below the constitutional age, but they are enlightened enough, appear matured enough, and appreciate the issues.
What's the standard? How do you pick and choose who an emancipated kid is?
Or maybe I should also ask, does Ghana Health Service have any policy around that? Is there any framework under these emancipated kids?
Yes, we do have, in fact, it's a decided case already on children like that around 16, around 15. The deciding factor is that of the professional. Whether this person or this child,
in your opinion,
or in your honest belief, according to the text, is able to appreciate the issues being discussed. They are able to appreciate the consequences. They are able to appreciate any effects as a result of the condition being discussed or even the procedure being discussed. And this went to court and it was decided. It was about a little girl about 16 years who wanted a contraceptive inserted, and she did not want the parents informed. And indeed, that was the outcome of that matter. That so long as
she was an emancipated kid?
Yes.
And so she could
have it without the consent of the mom.
You said she was 16?
16 at the time.
I want to believe that it's also because of the consent age for sexual activities. That's what probably was another factor.
I could guess so.
Yeah.
For us, our primary duty and the preference is to counsel the child to allow disclosure to the parents. It is when they insist, then we will choose between the fact that if she insists that no, and you go ahead to disclose, next time she won't come back to you. She will tell her friends that the hospital, the doctors can't be trusted, don't go to them. And that will hurt public health. So long as she insists against our counseling, and yet we think it is in the interest of the child. Remember, our Children's Act says you should not deny a child any treatment on grounds of beliefs. So a parent cannot then say that because of my beliefs, I will deny you contraceptives, so I will not let you do that. When the child insists, that's what they want, and the professional also adds that it is in the interest of the child.
Highly debatable, huh?
Yes, it is. I think we need to emphasize or remind ourselves that when conducting an HIV test, the consent of the patient is actually required by law. The Ghana AIDS Commission Act of 2016 demands that when you are conducting an HIV test on a person, they must know that you are conducting the test. I thought this is a very important piece that must be captured in our conversation.
The main anchor for divulging confidential information to other people is trust. The belief that this person is going to keep the information you've given them confidential.
Yeah.
Now, why is confidentiality very crucial to HIV testing, management, and just the condition in general? You would realize that malaria diagnoses are not guarded with this much confidentiality. We know the historical antecedents and all, but let's get our viewers to appreciate why, when it comes to HIV, confidentiality is very vital.
Very well. Thank you very much. You see, when HIV reared its ugly head in the 80s, there was a huge moral attachment to it. And it was also linked to persons who had been not delinquent but immoral.
In their opinion,
living wild. And so they thought, if I can put it in our local parlance, it's wenya HIV. it means that you went for it.
Oh.
When you're HIV, you went for it in your immoral state or life. You went for it. It has to do with sexual perversion. And so when you got the disease, and of course, remember, at that time, we had not made these breakthroughs, and so there was no, we didn't have the drugs. There was not the technical know-how and the education. The education followed later. And so it was deadly to contract HIV then. And even still now, you ask why. The disclosure is important because it has with it stigma and discrimination. When you do not manage the confidentiality of a person living with HIV's status well, you expose them to all manner of stigma and discrimination at home, at church, in school, at work, wherever, name it. Wherever man is found in the community, name it. They will bear that stigma if they are not careful for life. Beyond that, because of these ill attachments to it, they themselves also self-stigmatize.
Really?
Yes, they self-stigmatize. Doc is nodding his head. Let him come in at this point. Doc.
That is true.
How do people self-stigmatize?
Yes, there's a lot of internalization as a result of that. People have, like she said, the people who have acquired HIV, they're also in the community. So the same way they will stigmatize others, whatever reason they will use to stigmatize others, when they get it, they also assume same for themselves. And it includes even the fear of death. The belief was once you have it within the next 5 years, it's a death sentence. Then what people are going to think about how you got it affects morale. Beyond that, Noella, when a person gets this, they are thrown off emotionally, psychologically, mentally. A lot goes through their mind, how they are going to face the reality of it. A lot of them don't even want to believe it. I have a patient on medication for about 15 years now, but she still thinks it's a spiritual issue and all that.
Wow.
So we have all these difficulties facing them. And therefore, if you are going to make any disclosures, you should be very, very sensitive to manage even their emotions.
There is this reality about HIV, and like Madame Rahel put it from the very beginning, it's just the lack of information. But you would find that even with enlightened people, people who understand how HIV is spread or transmitted, because of how long the sociology or socialization has played out, you know that shaking somebody who is HIV positive would not give you HIV. But in your mind, you're likely to still go have that very long wash of your hands after. So it's like, I don't know what to liken it to, almost like racism, where the person knows it's wrong, but there's this micro nature of it in a way that makes it hard to call it out. But the one who is the patient can see through this, that you are managing me and pretending to be enlightened because you're required by society to be inclusive, but I can see the little expressions, the way you probably even overcompensate. Extra hugs because you want to show that you understand this condition better. And that doesn't help also. At this point, we'll go for a quick break. When we come back, we'll pick up the conversation right here.
So, for instance, in the health facilities, under the support of the Global Fund, to Ghana, since 2018, some identified health facilities were trained on reducing stigma and discrimination in the health facilities. Off my head, I can talk of Kolebu, I can talk of Rage, I can talk of Konfuanochi, I can talk of one of the first clinics in the eastern region. I can talk of, a lot, over 60 health facilities have been trained. It was a very great program because after the training of trainers, they were supposed to go and replicate same in their health facilities. Yeah. You know what they did? They identified champions and trained up to about 70% of the health facility staff. Wow. In that 70% included the one manning the gates at the security post, to the mortuary workers, deep into the pure health care workers. It has worked. There's a question of sustainability. I know that currently Bill and Melinda Gates under their foundation are helping to support it. Maybe it will also interest you to know that under the same program we pushed for, and now it seems to be working. Stigma, the topic or subject of stigma and discrimination has now been incorporated in the nursing training colleges. Okay. So they are going to have it as part of their curriculum. Every nurse that passes out now will have a solid grounding in human rights, stigma, and discrimination. This will not be just related to HIV alone. All other aspects, all other diseases. Yeah. So currently, this is what is going on. And of course, in the communities, at the community level, there's been a lot of advocacy. Recall in the early days, NCCE and the Ghana AIDS Commission with other national stakeholders and civil society organizations put out a lot of adverts. Why? It was to inform and transform so that we will reduce stigma and discrimination against persons living with HIV. You know, HIV, Doc will correct me, we call these diseases comorbidities. So a person living with HIV will be susceptible to tuberculosis, to COVID. And Doc is whispering. Doc will come in, and all other kinds of diseases. So these ones are all catered for under that broad umbrella to reduce. TB has also some stigma, some discrimination also. And so this is how the training, for instance, in the health facility went. It was not just limited to HIV, but also COVID and tuberculosis. I don't know if you will consider monkeypox at this time also.
And then perhaps, I think leprosy is also on that list.
Yes, a lot of our sicknesses have been on the stigma role, and I must say we've come a long way. A lot of education has gone on, and the situation has very well improved. I'm glad she mentioned that their training model included even the people at the security and all that. In fact, there are negligent cases that were decided against hospitals because of what security men did or what receptionists did. So incorporating all these are very positive. Gone were the days where we refer to patients by the kind of cases, the HIV woman there or that woman there. These things are all, done away with now. And I must say there's a lot of improvement within our healthcare space.
We've heard about the training. We have heard about all the efforts. But what is the situation on the ground? Are healthcare personnel now more realistic in their treatment of people with HIV? Are they wearing the triple gloves to attend to HIV patients and using their bare hands for the malaria patients? What is the real situation? Because at the end of the day, medical personnel are still humans. They also have families.
Your question, you see, I even want to... Your question brings... It's a very solid question. But you know what? All the efforts put into reducing stigma and discrimination, it has been massive, has been great. But we are not there yet, if you ask me. We are not there yet.
Indeed, the healthcare personnel also has to protect themselves from all opportunistic or all nosocomial infections within the hospital. They take a lot of infections. In fact, I remember my very first COVID, I had it for my patient. And I was not the only one. So there's a need to protect ourselves because from you, we are tending to the next patient. And therefore, if we are not healthy or we are transmitting infections, that will not be in the interest of the public.
I agree. That should be the standard for every disease. I mean, if you have your two double gloves for every condition, that is fine. But how would this HIV patient feel if anytime it comes to examining her, right before her eyes, she sees that you're not wearing 4 gloves. And afterwards, when you're attending to her daughter, who is not HIV positive, it's just 1. So whatever standard that you have, Because you see, it's not only HIV that you can contract.
Yeah.
You can get, like you mentioned, COVID. You can get other diseases.
But that could also be a misconception.
Okay.
Because the fact that a health worker is taking extra caution with regard to certain conditions may not itself mean discrimination. If I'm going to operate on somebody, and typically a lot of times you realize that you've been pricked by the needle.
Great.
Yes, we've seen it. Sometimes you may not even realize it until you've done the surgery before you realize that there was a prick.
That's
so
scary.
at times So at times we take some of these extra caution. It's not just that. At times somebody may have a very severe infection that if you don't double up on your gloves, you may end up contaminating even the space.
So it becomes a decision you take based on condition to condition. But that is where the problem arises. Why don't we have uniform protective policy that with every surgery, because of the issue, the possibility of getting pricked, you are going to wear 3 gloves, regardless whether it's HIV, whether it's just a hernia. You get the point.
So the reality of the differences in conditions cannot be wished away. They are there, they are realities, and come on, there were people having TB, people were having pneumonia and all that. We were not masking up as a nation those times. But when we assessed what COVID was, how it spreads and all that, then it informed practice on what to do.
Can we at least, okay, even in choosing to be a bit different in terms of your protection routine for HIV patients and in managing their other conditions, can you at least do it probably in their absence, so they don't make it too obvious that because you have HIV, I'm going to wear 5 gloves. Go extra.
Making it obvious is unprofessional, and I do agree with you on that, and I want to believe this must be rare. It must be very rare. It will not be the routine practice in any place that because the person is having HIV, when you are going to serve even paracetamol, you are masking up or you are, gloving and doubling it up.
So, and Rachel, soaking yourself
I must say it's on a rare side and not a routine practice, and we don't actually encourage it. We don't encourage that.
I think I agree with Doc on that one, except that talking of uniformity in the appareling, if that's how you call it. Because of the training we've given them, there's some kind of improvement. But where there must be of need to double glove, I think that the officer in question owes it to the patient. I'm double gloving, especially where you know that this patient is living with HIV. Make it conversational, I'm double gloving not because of so and so. This is part of
our protocol.
And they wear it.
Just to put them at ease.
Yeah.
We picked or sampled people's opinion on today's topic. Let's take a listen and then we can react to that.
The people's HIV status should remain confidential against stigmatization and discrimination. Though there have been lots of education, but people still stigmatize and discriminate people concerning their status. And for people not to be discriminated and not to be stigmatized, I believe that their status should remain confidential with them. The only people maybe they can disclose it to is their family and then maybe their partners.
So my opinion wouldn't change if my friend had HIV/AIDS, because true friendship means being there for someone, especially during difficult times. Having HIV doesn't change the person, especially when the virus cannot be spread through casual contact, like hugging, sharing of food, and talking.
I'm of the view that people living with HIV still face discrimination in Ghana. So mostly people, mostly due to stigma, fear and misinformation. And due to this, they even feel scared to even go to these health care centers because these health professionals even look down on them. So I feel to fight this stigma or discrimination, there should be more education.
Well, I'm not a health professional, but I know that this is so unethical to share someone's health status with a third party without their permission. Even when you put the ethical part of the entire thing aside, even in our interpersonal relations, day-to-day interpersonal relations, you should know that there's no way it is okay for you to share someone's personal information with a third party without their permission. And to even talk of the fact that we are in this society where illiteracy cuts across all hems of our being, you should know that stigma is attached to HIV positive people, and so therefore you should know that it's a no-no to share it without the person's consent. Even if it's with the person's consent, you should even come in as an advisor to even let the person know whether or not it is important for this third party to actually know about his or her medical status.
So I'll start probably with the very last gentleman, and I share his concerns that when we health workers decide to stigmatize our patients, they may choose not to come. I know the law has been quite forceful in a recent case where a nurse who had tested positive realized that some of the workers within the hospital space were looking at her in a way that made her think the information had been leaked out. And a very severe sanctions were applied in that case. So we should be very welcoming to our patients and should not let them feel that we are endorsing any death sentence on them, stigmatizing them and all that. It does not augur well for treatments. In fact, they may not even come to continue the treatments, and that will worsen the condition. It will continue to spread, and that will not be in the interest of any of us.
I've noticed that most of them have a fair appreciation of the conversation today, the importance of confidentiality in HIV-related matters in the space of the patient or the person living with HIV.
And that's very positive. I wanted to commend them for the level of appreciation they've expressed, and I think it's good for all the education ongoing. I think Rachel can take it up here.
Thank you. Yes, it is. Confidentiality was the beginning of our conversation, still is. Once disclosed to all the necessary parties under the Ghana AIDS Commission Act, or let me call it the HIV law of Ghana, no one else has the permission to disclose another's HIV status without their written consent. Written. The law is specific. It has to be written. And there are exceptions. As we all know, to every rule there are exceptions. So some exceptions lie. Under a court order, a disclosure can be made. For a research, a disclosure can be made. For further medical treatments, a disclosure can be made, and so on and so forth. These are some of the only exceptions that lie. Anything beside that is unlawful and can be prosecuted under this law.
I know we would want to look at disclosures within the sphere of family and relationships like spouses, immediate family, siblings. But before then, let's look at the testing, since you're talking about disclosure. Testing of pregnant women as part of their, I don't know what you call it, screening?
Antenatal screening.
Yeah, antenatal screening. What is the policy? What is the practice?
So these are important tests done as part of the general care of pregnant women. They are expected to attend the antenatal clinic, what we call the ANC clinics. Initial tests and assessments are made to ensure the woman herself is doing well. She can carry the pregnancy to term. Any other risk factors associated with the pregnancy are picked up on the side of the baby and also on the part of the mom, so that it can all inform optimal care. Now, when a mother has HIV, there's a probability quite high enough to transmit it to the child. Therefore, some measures are taken in case the woman has it, so that she's protected and so the child too can be protected. So the testing has become part of our routine test and screening, which then will inform us what to do just in case she has it.
So let's go back a bit. I'm really interested in this testing thing because I'm a mom and I do not remember having a conversation about HIV as part of my antenatal screening. So does it mean that you mentioned routine, which is the operational word here? It's treated like malaria, and probably like how they monitor your BP. Is that how it works? Such that once they take your sample, they have a checklist of things they need to test for, and HIV is just casually one of those on the list, and they check?
HIV is one on the list, but then the list is made known to the woman on the tests that are going to be done, and in case any of them happens to be positive, what would be done. So it is routine until a person decides to opt out. If a woman comes to us and insists that will not do this test, we cannot force it on the person. That is
granted she knows that it's even on the list.
Yes, they are made aware that it is part of the test to be done. And so maybe they should pay attention.
They are supposed to be made aware, but whether in actuality, based on the share numbers and how the procedure works, they actually know, that is a matter to be debated, right?
In fact, there's a counseling session, general counseling session for all of them, all pregnant women when they attend the ANC, especially in the beginning. And they are made aware of all these blood-borne sicknesses, including STIs and, of course, the HIV. It's generally mentioned, and we expect them to know that it is part of it. And unless they want to have a special discussions on that, of course, it will be their right to do so.
Yeah. Great.
Yeah, Doc, may I ask, is this applicable to public health facilities or also in the private health?
All facilities. Like I said, the duty of confidentiality is no longer just an ethical thing. It's also incorporated into law, and it binds every facility and every professional working within the healthcare space. So their patients are supposed to know the tests we are doing and the implications, whether positive or not, and whatever has to be done for them. The patients have a right to know these.
Let's now bring the conversation to who must know. But before the family bit, we talked about, yes, the fact that those managing your condition ought to know to be able to help you. But how many of those in the healthcare facility must actually know about your condition? Can we look at that whole chain? Definitely, your doctor must know. Attending nurse, who else must know? Because I sometimes wonder why the accounts manager knows somebody's medical condition.
That's a very interesting and important matter you've raised, Wela. Indeed, I think we discussed this the previous time, where we said at first we used to use the manual folders, and it goes around all the departments for drugs, for accounts, for assessments. So anybody who could read, well, thank God for some of
who was curious.
Our bad handwritings. Not everybody could read anyway.
Oh,
but for those who were able
intentional.
to.
Was that because I've always wondered why all doctors write in a particular way, which makes it almost impossible for us to read. Was it to help with confidentiality?
We will leave you to keep giggling on that myth.
Oh, you like the myth? Or you guys just write badly?
So for those who were able to read could do so, and that was unprofessional, it was unacceptable. These days, we are using the electronic systems, and not all the departments have access to where hardcore clinical information are kept. So it is so now minimized to
need to know
basis by professionals who really have access. So the nurse who is attending to you clearly will see the history to know what to do for you, the kind of recommendations we've done. The pharmacist who is supplying the drug may possibly also know, because he knows that this drug are for this or they are for that. Then the lab also
and
doing the
others,
test.
I guess.
And then a few others who do on just a need-to-know basis. In fact, even the doctor, and I need to make this clear, if I'm being a doctor, that's not entitle you to know everything about a patient who is not under your care. So if you're an obstetrician, gynecologist, and a man has HIV, and you come to a general doctor to ask the status, so long as you are not part of that care, you are not supposed to know.
So you can just casually, as a medical officer who has access, walk to another ward, check somebody's folder and give your own opinion?
Not at all. And I will use that to sound a bit of question. I think recently we've had some doctors giving opinions on a man's health status elsewhere when they've not had access to his folder. And we thought that was unfair and a bit unethical, because once you don't have a man's folder, in fact, you are not supposed to comment on it because you don't have the benefit of everything in there. There's a case recently where somebody's health information got out, and it was realized that some health personnel yes, they had access to it and they leaked it. Even though they were staffs of the hospital, they were still massively
penalized.
sanction for that.
I want Rachel to come in here about disclosures generally. So somebody has been diagnosed. Who should know around that person? Assuming the patient is married, has kids, definitely would most likely have siblings and other extended family members.
Okay, thanks, Nola. If the person is married, the husband or the spouse could be informed. I use "could" cautiously. Remember the sensitivity attached to this discussion. Depending on their relationship, what type of relationship they have as a couple, then either spouse can be informed. It is not done ordinarily. The health facility have some arrangements they make. They involve the counselors, they involve, where necessary, even reverend ministers or their imams and so on and so forth. It's a heavy conversation. So in that manner, some arrangement is made and the news is broken. But because under the law, you cannot disclose to anyone except with the written information of the PL, a person living with HIV, if the person agrees and so permits you, then you go ahead with this framing that I've just spoken about.
Okay.
While at it, unlawfully disclosing or outing a PL comes also with some heavy sanctions. There are cases that have gone to court, and we've won. What happened? There's a person living with HIV who was plying her trade, got into an altercation with someone who says, and he started, Mami ways are not you, Mamun taught me, you know that. So we took the matter on. Shraj actually advised us to take the matter on. We took the matter on and it was prosecuted.
Wow, so it is not there as a given that once your HIV status is confirmed, automatically they ask who is your spouse and then they bring the person in. Because infecting your spouse intentionally or infecting another person intentionally with a communicable disease is a crime.
It is.
So you have now, let's say before the diagnosis, you also didn't know. But now that you know, shouldn't there be in there a legal obligation to let any stakeholder in your life know about this? Starting with your spouse, people you probably might have had unprotected sex with in just the immediate past. You know, shouldn't that be a requirement?
I guess.
That in protecting your confidentiality,
Yes.
you should protect other people's health.
Yes. And in fact, let us even include this in our conversation. It has not just been all rights of the person living with an with HIV. No, they have responsibilities, there are obligations on them as well, which is what you've cited under the Domestic Violence Act. You should not infect another person, whether with HIV or any other disease. If you do, you come under the full rigors of the law. So that is it. Now, there is an obligation on a person living with HIV to disclose, particularly to a spouse. There is. But let me stray a bit. The days of the fear of HIV are over. I could say that. HIV has now become like your usual chronic ailments. Hypertension, and so on and so forth. Diabetes,
So long as
name
you're taking
them.
your drugs.
So long as you are taking your drugs. And so the ARVs come in very handy. If a person is enrolled on it and they are consistent with taking the drugs, you know what happens, Noella? They are, shall I call the CD4 count? Doc will come in.
So viral load.
Yeah, the viral load is highly suppressed so that they are even undetectable. At that point, that person is incapable. That person doesn't have the potency to transmit the disease to another. with or without
But
protected
they could
sex.
fall off along the line. And based on this, you need to let the person know that I am undetectable now, but I am living with HIV. Let's
Yes,
go for a break.
you are right.
And then when we come back, we need to continue this conversation,
Sure.
because even outside the conversation of spouses,
Yeah.
people you work with, you were a barber, and all of that, at what point must this conversation be had? Stay tuned. This is still Law Express.
Yes, so there's been discussions on disclosure to partners and also the duty on the PL or the person living with HIV himself or herself. Under the Domestic Violence Act, like she said, when you have it and you are going to have any sexual contact with a person and you know that you have it, you are to disclose.
And that is whether it shouldn't matter whether you're detectable or not, right?
No. I'll get there, yes. So under that law, you should disclose. But then there's also an intent to the law, and that is to avoid harm. So where in our setting we realize that there is also no harm, or we can abate the harm, then the question may arise as to whether it should be disclosed or not.
You're punching in the dark at that point.
I'll get there.
Because you, in good faith, believe that your viral load is so low that you cannot transmit this. But what if there is a lapse there?
I'll get to that. According to the Ghana AIDS Commission Act, it also said in doing these disclosures, in the first place, once we realize you have it, our counseling is that you should disclose to your spouse so we can attend to the spouse.
Yeah.
Because the earlier the better if they start the treatments and the management. So that's our first line of counseling. But the law realizes, according to I think Section 34 of the Ghana AIDS Commission Act, that where you also realize the person insists, no, don't, or does not want to disclose, because there's a possibility of violence, there's possibility of harm, there's also the possibility of divorce, and all that. The person feels at this point it's not conducive to make a disclosure. You, the doctor, you don't go behind the person, breach confidentiality, and make the disclosures. So we then say there are ways of managing the situation such that the person, the patient living with HIV, will not be a risk to the spouse or the partner by instituting the ART, the treatment. And once they start the treatment, they are at a very low risk. And now looking at the dynamics, I introduce the partner's nature or the dynamics of the partners. A male may have it, and we are looking at he disclosing it to the female partner, or a female may have it. The approaches are different in the sense that when a man has it, by the first sex, about 50%, there's a 50% probability that the first sex can transmit HIV. By the second, third, there's about 99% probability that the woman has it. At that point, the man himself may probably not even be aware that he has the HIV. So he's typically not caught by the Domestic Violence Act requirement of disclosure, because there they make room for the menstrual, you knowing that you have it. So typically, when a man has it, it almost automatically gets to the female partner, even without his awareness. We'll come to those who are aware and decide to still transmit. That's a different matter. But when a woman has it, it's a different thing. Typically, it takes a while for a woman to give it to a man. It's a bit difficult for a woman to give it to a man by way of our anatomy and the dynamics of sex, depending on how they are. In fact, throughout my practice, it's only once that I've had a couple come in, the man has it, the lady does not have it, they've lived together for like 6 years. I asked them how they managed to do it. They just giggled at me and they went away.
Normally, when the men have it, the women automatically have it.
Almost.
But
almost.
So there are women who have it and the men don't.
Don't. And I have about 5 or 6 women who told me they do not want the men to know because of the circumstances.
This is cruelty,
of their domestic
if you
life.
ask me.
I wouldn't say it's cruel because
not
we
quite.
then also proceed to put in place measures, the treatments and all that
To protect
the man. And outside the typical example I have with you, I'm sure he's probably even be listening. This lady came to me and she indicated that she's already been on the medication for 6 years. The man does not know and she does not intend disclosing. One day, The man went to an area of their wardrobe where she kept her personal stuffs and discovered the drugs. So he googled and got to know what the drug was for. The man got extremely angry and even left the house. After about 2 weeks, he came back to the house. Now, sober, approached the lady and even thanked her. Apparently, when he went out there, he went to do the test and realized that he's been negative. And they then counseled him that you are negative because of the medications your wife was taking. So they made up, and life is now continuing on. But in the heat of the time she got it, if a doctor had gone behind her to make the disclosure, you can imagine what can happen.
I'm not expecting medical personnel to be breaching the rules on confidentiality by talking to them. But I'm just looking at a situation where the law makes it compulsory for you to tell whoever you are having this kind of relationship with that this is your status. Because you owe it to that person. It does not become your right or decision to say, okay, I am taking steps to protect this person from an infection, and based on that, they do not deserve to know. It's like you are playing God and suggesting that, this person might react badly, the marriage might end, and because of that, I decide how I manage information that affects the other adult's life.
But that is part of the law, actually. The law also makes room for that. So that when she thinks her life could be in danger, the law permits that. Yeah. That we can withhold disclosure.
So this is where I find the fault. I think there is a little, defect in that bit. Because you can never control or decide when it is okay to tell somebody. You might think, I'm sure you would have seen people who were properly counseled. You assume they were ready to now know about the situation. You break the news and it still affects them. There are even patients, and this is them who were infected, that you counsel and they are all prepared. But once the reality of the condition finally hits them, you see how it works out.
You see, the technicality of Section 1 of the Domestic Violence Act is that you must make a disclosure when you know you have an STI, something of the sort. In relationships of this kind, intimate partner relationships, you are enjoined, a person is obligated to disclose to the other whom they are going to be sexually intimate with of their condition. It goes beyond HIV. All manner of sexually transmitted diseases, there must be disclosure. It is when you fail that now you're on the wrong side of the law. Yeah. Now you see, these are two people meeting elsewhere, having their jolly good time. The requirement of the law is that if you are going to have unprotected sex, if I'm the one introducing this, let me know. But once you are going to have unprotected sex, there must be that disclosure. Now, Noella, you and I will never be there when people are engaging in these things, to know whether or not it is protected or unprotected, to know whether or not in my string of partners, sexual partners, which one of them gave it to me or I gave it to. It is a difficult conversation, but you see, the law is a sword, the law is a shield. And I think this is how we are playing it and utilizing it, especially in this HIV context. We want to uphold homes. Noella, do you know how many adolescents are living with HIV?
I don't have the stats.
They are a lot. They are a lot. And most of them are orphaned.
Okay, so parents passed it on.
Parents
are gone.
So I've brought in
to
this,
manage.
Yes, with the ANC routine text that we discussed earlier. It is essential.
We have a few questions coming in on our social media handles. Let's try to answer them to the best of our ability, considering that we don't have the opportunity or the option to follow up, to ask for further and better particulars.
There is a health worker in our neighborhood who likes to advise us at night. She doesn't care about what time of day it is or what you are doing. She has to say her piece. Last week, whilst advising us against behaviors that could lead to HIV infections, she named 2 young people in the area as HIV positive people. I know she means well, but I am alarmed at her conduct. Can she be arrested for this? Do our neighbors owe it to us to let us know their condition?
That was unfortunate. She can be taken on by the HIV law. You can make a report at the Ghana Police Service nearby.
Even though you are not the one affected?
Yes, you can. You can make a report or advise the person affected to do so. The channels of reporting are many. If it is not institutional based, you can make these reports at Shraj. You can also report at the police service department. Any police office close to you, you can do that. And of course, if you want to take up legal action directly, you could also do that.
But here's a case where this is just nuisance, if you ask me. She thinks she's trying to help you to not get infected, and then she overdoes it by outing others without their consent. So those people probably can act, but here's the case, they were not there. They probably never had. It's a bit mixed up. I think that she has to be spoken to. Probably
Yes.
after, based on the police reports, I'm trying to figure out all the lines, all the actions that can be taken
Clearly,
beyond the police report.
Yeah.
Clearly, this was a breach, ethically and even legally. What we do is you can advise people, educate, but according to a case decided ex parte Info Solutions, whenever you need to disclose such information for such purposes, you exclude the name and every identifiable element of the disclosures that can link your disclosure to a particular person. So it all comes back to education so that our campaigners know they are doing a good job. I don't think she intended causing this harm, but yes, this is harmful, unacceptable, and it can be taken on legally because the law directly prescribes against this.
Once we're still talking about disclosures, let's dovetail into whether or not your family members must know, your other family members. We already talked a bit about people you have intimate relations with. But what about, I mean, when I say intimate, your family too is intimate, but sexual partners, okay, we've had a little bite on that. What about your immediate family, your siblings, your parents, your children? Must they know? Because I'm looking at the risk of the toothbrush. I'm looking at the risk of the needle.
Now, like we've said, the principle is on a need-to-know basis. Other siblings are not at risk of direct blood transfer, direct blood contaminations, and therefore I would say it's unnecessary to make those disclosures. But we do say that you need some form of support. At times, we even need somebody who will assist you with your medication intake, be reminding you. Sometimes some people may even assist you in collecting them. Your question reminds me of instances where an HIV person will be in the hospital. He's being taken care of by a relative who is washing their clothes, doing all that. Sometimes they are exposed to some of the blood contamination, but then they are not informed and they may not know the exact condition. What we tell those people is, look, your relative has a condition we are managing. It can transmit by blood, and therefore wear gloves when doing that, but protect yourself. In confidentiality breaches, and confidentiality can be broken when there's a need to protect others, when there's a need to prevent harm. But the rule is, or the guidance is, you disclose what is minimally necessary. So in the case of the relative, if I can minimally say that wear gloves, do this, do that to protect yourself without necessarily disclosing the exact diagnosis, then the ends have been achieved. So we do not go about mentioning the person's condition to children, the entire household, simply because they are family and they are offering support. The emotional support is necessary, but we do not think they must necessarily know the exact diagnosis.
Are we not prioritizing the patient above the other members of the family in terms of safety and risk?
So maybe if you can also point the risk herein for which we are preventing, because the risk is very minimal.
Well, it's a case where it's even not compulsory to tell somebody you are having sexual relations with that you definitely have HIV.
Yes, because
you
he's taking the medication.
Exactly.
The suppression is low. There's no realistic
it's
chance.
It's easier to take from a medical point of view, but for the rest of us lay persons, this is a huge problem.
Okay, so where the risk is low, or there's no risk at all, there's no need. Still operating on the principle of need to disclose. I mean, you've visited a barbering shop, for instance.
Great.
If the barber is a person living with HIV, what is the need for him to disclose to you his status? Because you see,
you work for a shop.
They
objects,
do
razor blades.
They do, and we assume that their equipment will be sterilized or very well sterilized, or you've walked in with your own. Whichever is the situation, the risk is very, very remote, because as doctor can confirm, the HIV virus has a very short lifespan when exposed to the air, and there must be enough quality, enough quantity, and actual route to exist. All these must be present for HIV to be able to be transmitted from one person to the other. You see, so when we say need and when we say risk, we are also saying that how close or how remote is it? If it is very, very close, like an intimate partner relationship, for instance, and then you weigh the circumstances and there must be some disclosure. Doc has given us the guidelines to go through. They do disclose. But where in the context they are having HIV, one is a PL or has other sexually transmitted disease, but they always practice safe sex, protected sex, then the need to disclose also is minimal.
So you have HIV, you're going to have an intimate relation with somebody. For as long as you know that you're going to wear a condom, then it's no longer necessary to disclose. Because what about if the condom breaks? Because
the harm has been mitigated. And for every person going into such an activity, there is some inherent harm anyway.
Yes.
Condoms are advertised that they do not offer 100% protection.
Yes.
So once such risk has been assumed per volunteer of it, then it is assumed that it is very minimal and we don't need to rattle.
From what you're saying, Doc,
people.
if I were to work with this, what you're just saying is nobody should have sex anymore, because condoms are not 100%, but they are the lead thing, that contraceptive that is used for protection from transmitting HIV. Now, if it's 99% or whatever percentage you throw out and it still can break, don't you just think that, look, before you get into that space with somebody, the person ought to know that, hey, I am HIV positive, but I'm going to use a condom, or it's not even traceable at this time, but still to protect you and for comfort, I'll use a condom. You should know it can break. If that happens, that conversation should be had. Such that if you find out later that the person had HIV and did not give you that, information, that's so wrong.
Yeah. That's the dictate of the law. Yeah. But you and I know, typically, practically, people won't do that.
Well, in the heat of the excitement, do people, I'm sure there would be times that people go like they don't care.
They don't even care.
Give me HIV.
So that's why on public health grounds, we are focusing on prevention and also making sure that both parties are on the medication so that the risk is so minimal and it may not necessarily happen.
We would never be able to exhaust this conversation. So, but we need to, for lack of time, wrap it up now. Perhaps we can pick up another component of this conversation on another day. I'm so grateful that you came today. Healthcare professionals are ethically and legally required to keep all information about patients confidential. And information about a person's HIV status may not be disclosed to any other person without the principal or the patient's consent. Our conversation today has been on HIV and confidentiality. I'd like to thank Madame Rachel Operiata, Mrs., for coming by today, and also Dr. Edward Adodankwa. It's been an awesome conversation. We hope to see you again on the show next time. This has been Law Express. My name is Noella Seydu. Till next time, goodbye.